So take a look at the scan of one of my patients who's having back issues, back pain. And as we can see there, that's the culprit. The right L5 pars had actually been fractured. And as you can see from the scan indicated on that end, you can see there the bone actually fractured from that end, as you can see right through there. So what we're talking about is at the back of the spine. So to orientate us, we've got the front here where our stomach would sit, and this is at the back here, and we're specifically talking about this part of the back of the spine there, which is where your lamina and your pars come through. And so what was happening is we actually had a fracture, in this patient's case, through there. Now that had come from repetitive extension and loading, and that had resulted in that fracture occurring from there. And the great thing is, again, that the assessment guided what we needed to do from a rehab point of view, because it showed us how it happened, we could understand how that occurred, and also guided what we needed to improve upon to actually fix the issue. So in this patient's case, they were resulting in extension loading. They were unable to keep their spinal control under load, and they were defaulted to extension when they were lifting, squatting, running as well, and that just kept the tissue sensitized, because in her case it was an older fracture that had been happening. It had been there for a while, but she just kept loading on repetitively. That kept it aggravated. So again, the scan only tells us one portion of the issue, but it doesn't tell us how we've got to actually fix it. So that's again why a thorough assessment gives you the accurate diagnosis, tells you how to actually fix and rehab the issue.